Okay, let's talk about something that's honestly pretty terrifying, an eye burn. It's one of those emergencies where every single second counts, and it can happen to literally anyone, anywhere. So in this explainer, we're going to break down exactly what you need to know, and more importantly, what you need to do in those first critical moments.
I mean, just think about it for a second. It could be something as simple as a splash of drain cleaner while you're doing chores, or maybe some sizzling oil jumping out of a pan, a flash from a welder's torch. These are things that happen in the blink of an eye, turning a totally normal situation into something that could threaten your sight.
And really, that's what this is all about. In those moments, knowing exactly what to do can make all the difference. It can literally save your sight. Our goal here is to give you that clear, direct knowledge that can mean the difference between some temporary pain and, well, permanent damage. So let's start by really understanding the threat. All right, so first things first, we've got to understand exactly what we're up against. What is it that makes an eye burn so uniquely dangerous to your vision?
Well, at its core, an eye burn is damage to the incredibly delicate tissues of your eye. We're talking the cornea, the conjunctiva, even the parts deeper inside. See, a burn on your skin is bad, right? But a burn on your eye, that's a direct threat to one of your most precious senses. And understanding the cause of that burn, that's the first step to knowing exactly how to react.
The threat really comes from 5 main categories. We're going to quickly go through each one because knowing the source is absolutely key to the right response.
First up, we've got chemical burns. These are super common and extremely dangerous. Now, there's a really critical difference here between acids and alkalis, or bases. While both are obviously bad, alkalis, the stuff in drain cleaner, cement, or ammonia, are often way worse because they just keep going, penetrating deep into the eye's tissues and causing damage long after that first splash.
Next up are thermal burns. These are probably the easiest ones to picture, right? Think about a splash of hot cooking oil, a blast of steam from a pot, or maybe a spark from a bonfire. Your eye has a natural blink reflex that helps, for sure, but it's not always fast enough to stop a serious injury.
Now this one is sneaky because you often don't even feel it until hours later. It's basically a severe sunburn, but on your corneas. This can happen from the sun's reflection off snow or water. You've probably heard of snow blindness, or from artificial sources like a welder's arc or even a tanning bed.
Electrical burns are they're complex and they're severe. An electric current can travel right through your head and your eye, essentially cooking the tissues from the inside out. And this can cause all sorts of damage that you can't see right away, like cataracts forming later on or damage to the optic nerve. And finally, there are friction burns. Now this happens when there's intense, continuous rubbing on the surface of your eye, usually because you're trying to get a piece of grit or something out from under your eyelid. All that constant rubbing can actually generate enough heat to damage the cells on the surface.
So, now we know the causes, but how do you know when an eye burn has actually happened? Well, trust me, your body is going to send out some immediate and very, very clear alarm bells.
The key symptoms, they're really hard to ignore. You're likely going to feel severe pain, see some intense redness, and probably have blurred vision. Your eye might start tearing uncontrollably as it tries to flush itself out. Plus, you'll have this extreme sensitivity to light, and that awful, gritty feeling like sand is trapped in your eye. If you experience any of these signs after a potential accident, you have to act fast.
And this brings us to the most important part of this whole thing, your immediate actions. When it comes to an eye burn emergency, what you do in that first minute can literally determine the outcome for your vision.
What you do right there, on the spot, isn't just first aid, it's sight-saving treatment. Your one and only goal is to minimize how long that harmful stuff is in contact with your eye. That's it.
For chemical burns, this is the single most important thing you can do. Get to a source of clean, cool water. A tap, a shower, a water bottle, anything. Tilt your head so the injured eye is lower than the other one. This is super important because it stops the chemical from washing into your healthy eye. Then use your fingers to hold the eyelids open because the natural reaction is to squeeze them shut and just let the water flow gently but continuously across the eyeball.
And listen, this is not a quick rinse. Please do not stop washing after just a minute or two. The absolute bare minimum is 15 to 20 minutes. And for those really dangerous alkalis we talked about, like drain cleaner or wet cement, you need to flush for 30 to 60 minutes. Seriously, you should be flushing it even while you're on your way to get emergency help.
Okay, let's just nail this down. The do's are simple. Wash immediately and get help. The don'ts are just as critical. Do not rub your eye. That can grind particles in even deeper. And never, ever try to neutralize a chemical, like putting a base on an acid burn. You can actually create a chemical reaction that generates heat and gives you a thermal burn on top of the chemical one. No good.
And don't put any ointments in, just wash, wash, wash with water.
So you've done your part with first aid, and you've made it to the emergency room. Now what? Well, the medical professionals are going to take over with a very specific protocol.
First thing they'll do is keep washing your eye until the pH level is back to normal. Then they'll use special dyes and a microscope to see just how deep the damage goes. You'll almost certainly get a course of medicated eye drops, antibiotics to stop infection, and steroids to keep the inflammation down. And, in really severe cases, surgery might be needed to repair the eye surface.
Okay, we've gone through the danger and the response. Let's talk about the best strategy of all, making sure this never ever happens to you in the first place. The strategies here are pretty straightforward, but they are so vital. Always wear the right safety glasses for the job. Always read chemical labels before you even think about using them. Protect your eyes with sunglasses that block 100% of UV rays. And here's a final, really critical tip. Be prepared. Having a bottle of sterile saline solution in your first aid kit at home and at work is such a simple step that could literally save your vision one day.
When it all comes down to it, it's this simple. Knowing emergency first aid is vital, absolutely. But creating a safe environment and just using your protective gear, that's the only way to guarantee you'll never have to use that first aid knowledge.
It all boils down to this one simple question. Taking a few extra seconds to put on safety glasses, or to be a little more careful with a chemical, that's not an inconvenience. It's an investment in a lifetime of sight.